The true power of AI is yet to be fully harnessed. The capability of current algorithms can really augment current clinical pathways of care, but the future of this space is quite transformative. There are two ways that pathways can really change. One is if you apply an AI to a current pathway as an add-on. This will mean augmented outcomes, or augmented diagnostics, and augmented capabilities to treat, so that we can use an AI tool in the place of current tools, but in a way that they are stronger and better for patient care. That is one way, and we can focus on expanding our outcomes based on that. The second way is a more transformative way, which will be the AI of the future. That is its capability to predict and augment treatments so that as someone presents to a health system, it can be managed, identified, and treated at a much earlier stage of disease than is currently done so. This is called preemptive care, and with the predictive algorithmic capability of AI, diseases can be mitigated at their origin so that the disease course will be much more substantiated with a way of treatments, and as a result, the outcomes are much better and the treatment course of pathology is much more subdued. This way, we'll be able to have an understanding of disease, treat it right at its origin, and as a result, the actual disease won't flare up in the way that we understand it today. For example, we can identify cancer at the origin, and so no one ever has to go to a late-stage disease and then be treated. That is the current model of care we have today, and so most diseases present with symptoms, and as a result, we treat them at that late stage. The point of having an AI clinical pathway is that we can understand and predict disease right at its source, and so we can get it at the level of the symptoms and probably before. By doing that, we can mitigate the whole complexity of disease, understand it at its source, treat it early, and patient outcomes will be better. This will be good for patients who are end users and will augment the capability of our physicians and healthcare providers.